Turning now to your community focus, the CDC is tracking yet another new variant of COVID-19. Joining us now to talk about that and more, Dr. Phillip Chan with the Rhode Island Department of Health. Thanks for being here.
Thanks for having me.
All right, so let's start with that new variant. What do we know about it and where has it been detected?
XBB 1.5. Sounds like a familiar story, huh? So it's upwards of around 75% now in New England, and unfortunately it's more transmissible than anything we've seen in the past.
Wow. Yeah, and so now that we're past the holidays, are we seeing a spike in COVID and other respiratory illnesses, flu, RSV?
Yeah, unfortunately we are. COVID has started to spike up again. We are now seeing high community levels in Rhode Island. The good news, though, is that we anticipate it will only be here for a short amount of time before we start to come down.
That's good news. And getting back to that new variant, what do we know? I know you said it's more transmissible than we've seen before, so what do we know about how well we're all protected against that variant, especially if people have, been boosted or gotten that bivalent booster?
Great question. So it is an Omicron subvariant. The good news is that the Omicron booster should protect against it. We're still learning about it. It's so new. But definitely get out, get the Omicron vaccine if you haven't gotten it, especially if you're older, especially if you have other medical conditions.
I wanted to ask you a somewhat related question about the COVID vaccine while we're on that topic. We've been seeing online some people making this idea that maybe the COVID vaccine might have played a role in Damar Hamlin's injury. We've gotten some questions about this. We've heard reports of myocarditis before with the vaccine, and I think people are wondering, I don't believe we know his vaccination status, but people are wondering, could the COVID vaccine have played a role in what happened on the field?
Good question. So I do want to be absolutely clear that the vaccine did not cause what happened to Damar Hamlin. It definitely did not. We do know that there is a small risk of myocarditis with the vaccines, but actually if you get COVID, the risk of myocarditis is actually far more than what it is for the vaccine. So the vaccines are safe, they're effective, people should get them if they're indicated.
Now, we have reported here on 12 News before about the shortage of children's fever and pain-reducing medications like Tylenol, Motrin. What is the latest with that? Is that still something to be concerned about?
It is something to be concerned about. We are seeing supplies tick back up. RSV, which is the major cause of respiratory illness in kids that we've seen last month, is starting to come down. It has come down. We are still seeing flu as well at significant levels in the community, so definitely get your flu shot as well if you haven't gotten that yet.
And talking about kids, we know that Boston schools have asked students and staff to wear masks when they return from winter break. Not requiring it, but sort of expecting them to. If I were a local superintendent asking you for advice on masking right now, what would you tell me?
I'd say it's a decision really for the district. We've really empowered the school districts, the superintendents to make that. Every community is different. We're not seeing the same levels of COVID everywhere, so it really is a school level decision. It is recommended by the CDC when we are at high levels, which we are, to consider masking. And I definitely want to recommend people that are at higher risk, those that are older, other comorbid medical conditions, should probably be masking to protect themselves.
All right, Dr. Phillip Chan, that is all the time that we have for today. Thanks so much for being here.
Thank you for having me.